Jail health employs psychiatric providers, meaning physicians and nurse practitioners who prescribe medications to patients, psychiatric evaluation specialists, nurses, and a social services team to provide behavioral health care and services at the downtown jail. This is an especially complicated operation because the jail is a secure environment. Jail health staff work closely with and depend on DAJD to provide health care to patients. This requires extensive communication and coordination, which can complicate otherwise simple healthcare interactions. For example, if there are no correctional officers available to escort a patient to their next appointment, jail health providers have to adapt as best they can. This means that jail health provides many patients with care they do not receive anywhere else. Jail health prioritizes stabilizing people who come into the jail with higher behavioral health needs. This is a reasonable approach, but can leave some gaps for patients with lower or less visible needs. Lastly, jail health provided a supply of behavioral health medication at release to approximately 20% of people with a prescription for those medications at the jail in 2023. Jail health is already considering efforts to increase the supply in the future, but there are opportunities to reduce barriers for patients now. So we'll go ahead and dive in. The first area we looked at was how long it took for patients to get their first behavioral health medication after they were booked at the jail. And we found that wait times for psychiatric clinic appointments may be a barrier for some patients. We analyzed jail health data from 2023 and found jail health ordered most behavioral health medications within 2 days of a patient's booking, and most patients received their medication within 24 hours of jail health placing the order. However, we also found that some medications were ordered more than a month after booking. Many factors can affect when jail health places a medication order, but some patients can't have them ordered until they've been seen at a psychiatric clinic appointment. This graphic shows the end result of patients' first psychiatric clinic appointment ordered in 2023. In the blue slice, you can see that 60% of these orders were not completed before the patient was released. These are situations where the patient entered, stayed at, and left the jail without seeing a psychiatric provider for their needs. In the orange slice, you can see that 22% of appointments were completed. So diving into those, of these completed appointments, about 34% were completed within jail health's 30-day goal, and most were completed within 60 days.
Also, in 2023, we found that fewer than 20% of all patients who were prescribed behavioral health medications at the jail received a supply at release. And this could be partially because, aside from programs that focus on patients in some priority groups, such as those taking medications for substance use disorder, for many patients, getting medications at release is up to the discretion of the provider or a nurse, or a proactive request from the patient. And multiple patients that we interviewed were not aware that they had the option to request medications at release, but they said they would have done so if they had understood that option.
Really, we have structures and systems that could align better. I think everyone's in agreement with that. And I know when I went to Arizona to look at the crisis care center model, before working to bring it here with exec and our colleagues, this was an issue. For the very best gold seal of approval, you go to the crisis care center, the very best one, and they have issues with timing of medication. So as a country, we're not doing well with this, or as well as we could. And now we have these crisis care centers coming in our space here, approved by the voter, overwhelmingly approved by the voters. And it's the most cost-effective approach we can take.